Now is Dr. Robert Murphy. He's a professor of infectious diseases in Northwestern University Feinberg School of Medicine. Good morning. Thanks for being with us.
Good morning.
So this has been a slow rollout, and is this a big problem? Is it going to speed up? Could we get 1 million doses a day of vaccine?
Well, the way we're going, as Mayor Lightfoot said, it's going to take 1.5 years, maybe 2 years to get everybody vaccinated at this rate. This is not being taken as an emergency, and there's very chaotic planning that's happened. This has to change. Otherwise, it's going to be 1 or 2 or more years before people get vaccinated. And the infection is getting worse. Look at what's happening now with this third wave we have and the introduction of the variant virus into the population. It's a crisis and it's an emergency. It should be 7 days a week.
Air travel was up. Do you think that'll have some kind of impact on the numbers?
Well, I'm really scared about that. The interesting thing about it, Larry, is that on the airplane itself and at the airport, yes, there is some trouble. Look at the picture that you're showing there. But most of the infections are occurring at the place of destination. So the people go through all this travel and risk of traveling, which is mild, actually. Then they get someplace, they're in a house with somebody and they get infected there. That's primarily where it's happening. And then they bring it home. So it's all this, it's the movement of people as well as the mode of transportation. It's both.
Getting back to the vaccines, there's been talk of giving people only 1 of the 2 Pfizer doses, or maybe reducing the strength of the Moderna vaccine in order to get more people vaccinated. Is that a good idea?
That's a great idea. And look what the UK is doing. They've approved AstraZeneca's vaccine, which we don't even really know the data on AstraZeneca, believe it or not. It's cheap, and it only has to be in a refrigerator. That's terrific. The data is all kind of mixed up. However, they got that thing approved. It is out there. They've moved the second booster dose to 3 months from 1 month. That gets a lot more people vaccinated, because you do get protection after the first dose. But you get the booster effect, gets you much longer protection. They've done that. Moderna came out, or the Warp Speed director has been in discussions with Moderna, the maker of the second vaccine, and in the populations they studied in phase 2, not the last big 30,000 person study, but the one before that with hundreds and hundreds of people, that there was no difference with a half dose in people 18 to 55. Now, this makes sense physiologically. So they're saying lower the dose for those people. Now, if you have a risk factor underlying immunodeficiency, no, you take the higher dose. But for the otherwise healthy 18 to 55, lower the dose. That'll double the amount of vaccine we can give. This is incredible. Right. So all these things have to be taken into consideration.
All right, let's get to viewer questions. What does it exactly mean that this new strain of COVID is more contagious, that masks are not as effective, 6 feet distance not enough? What new or additional measures can we take to protect ourselves when we are so close to the vaccine being fully implemented?
Yeah, no, this really hits the crux of the problem with the variant vaccine. This virus is much easier to transmit. Remember, we talked about that R0 factor, how many people the average one person will give. So they're saying it's easier to transmit, maybe up to 70%. We don't even actually know the real number. Once you get the virus, so far it appears that it acts just like the regular wild coronavirus that we have always had. But it's that transmission. However, if you increase the number of infections because it's so easy to transmit, it's still a horrible thing what's happening, and it's going to implode the healthcare system. And that's why the UK has taken such aggressive steps, because now they're over 60% with the variant. And they're seeing if you look at the curve of the United Kingdom growth, it looks like this straight line going straight up. It's a very frightening thing. But wear the mask, do the social distancing, stay away from crowds. Don't be with people who are not social distancing or wearing a mask. I mean, that's basically what it's telling you.
Okay.
It's mitigation.
Quickly, another question. Would taking an antihistamine like Benadryl prior to getting the vaccine help to minimize any allergic reaction, or would this be dangerous given it was not tested for in the trials?
Well, I don't think it would be dangerous. I don't think Benadryl would be dangerous. But I don't, Benadryl makes people sleepy and groggy and everything. I wouldn't be giving millions of people just a dose of Benadryl. I mean, half the people would fall asleep in a couple hours. I mean, it's a, but if you have a history of allergies, that Benadryl and epinephrine need to be handy. Now, I think maybe we've scared people a little bit too much because people are put off, especially the nurses, about taking these mRNA vaccines, the Moderna and the Pfizer. That side effect is occurring in 1 out of 43,000 people who take it, and everybody that got Benadryl and epinephrine did well. Nobody has died from taking this vaccine. So, and now we have the AstraZeneca, or we will maybe soon have it. There's a bunch of other ones coming down the line that are completely different that may not have this anaphylactic reaction. So you can wait, but the virus is spreading like crazy. So I still think you should take the first available one you can
All
get.
right. Thanks, Dr. Murphy. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Have a good day.
Thanks, Doctor.
Okay.